Hi everybody, I'm Dr Denz and I thought I'd take this opportunity to talk to my patients and anyone else that may find this useful or interesting. Coronavirus has created a very unusual situation, something we haven't seen for 100 years, and there's no doubt that it's a significant pandemic and we need to take the precautions to minimise spread and follow the government's instructions. They have a specific plan they want us to stick to, and you should follow their guidelines as much as is possible. Having said that, it's important that you don't ignore the other medical problems that may exist in your life or any significant symptoms that you develop over the next 12 months, because there's no point in avoiding getting the coronavirus and suffering some serious ill health as a consequence of ignoring symptoms. Consistent with this, the Chief Medical Officer said yesterday that he's very concerned that patients are avoiding general practice and not taking care of their other health issues. An example of problems I'd be concerned about are developing stroke secondary to poorly or uncontrolled diabetes, or untreated hypertension, or getting tetanus because you didn't have a vaccine after you injured yourself in the garden. It's important you know that we are still here. We are still open. We're open every day, 7 days a week, and we're here to provide those healthcare services that you need. So while most people are stuck at home on self-quarantine, this is a good time to come into the surgery and have your prolonged health assessment if you are eligible, or to have your routine monitoring of your chronic health conditions such as diabetes. And on top of that, don't forget to have your vaccines and to make sure your children still have your vaccines. It's important to remember that we still live in WA. We spent most of the last 12 months outside in the sun, and it's still important to do your skin checks. There's no point in surviving the coronavirus pandemic and finding out in 12 months' time you've got a melanoma because you didn't have your annual skin check. General practices generally are a safe environment. We've always taken steps to avoid any risk of cross-contamination or infection from other patients. In the past, whenever we saw a patient with what we suspected was a contagious condition like flu, we'd isolate them in a separate room. We do have an isolation area in the surgery that we can use if in any event we have a patient with upper respiratory tract symptoms. But as a rule, we do not treat COVID-19 patients here. They are screened out before they get to the practice and they're sent straight to the hospital or the COVID clinics. One thing to remember is that even in quarantine or social isolation situations, the government is very happy for you to attend your medical appointments. This would not be the case if this was a high-risk activity. Now at this stage I'd like to say thank you to my staff who have coped with an enormous change in our normal operations and new systems, and I really appreciate my patients treating my staff with courtesy and respect with the understanding that they're doing their best in a difficult time, and appointment scheduling is much more difficult now than it has been previously due to the new requirements.